President, the office bearers of the club, Rotary Club of Madras, my friend Paul Jacob, who invited me for this very important function. First, thank you, and my apologies for being a bit late. I'm running from an event at the IIT Madras campus, and the traffic was a bit worse than I thought with the rain. Actually, I was supposed to be on a flight to Cochin right now, and when Paul asked me to stay back and come, I said it would be my privilege to come and felicitate the recipient of this award, Thiru Narayana Murthy, an icon of the industry and somebody who laid a path for the sector in India and showed the scale and the extent of what was possible in a global market as an Indian company. So I shifted my flight to 8:40 and I'm very happy to be here. I consider it a great privilege for me, especially as I'm the IT minister. I must say that in Tamil Nadu we had the great luxury of some vision back in the late 90s of what the sector could be. And we set up a separate department, we set up some policies, we set up some companies. But in fact, through the efforts of people like Mr. Narayana Murthy, Bangalore has far exceeded where Chennai used to be, and now with my friend, the former IT Minister of Telangana, KTR, Hyderabad also has scaled great heights. Pune is a great competitor. Of course, in our time in government and in my time in this portfolio, which is about 6 months now, we have tried to get a feel for what is it that we're not doing so well and what should we do better and how can we compete in this market. I would say the good news is that the scope is immense and that in some sense some of these forerunners are reaching some measure of saturation and we are seeing a lot of the demand. I held a review recently with some real estate firms and they told me that Chennai has seen uptake of almost 10 million square feet of new space this year, Class A commercial space. And some of that is actually people who have reached saturation and want to de-risk from having too much in one location in places like Bangalore. Anyway, be that as it may, we have work cut out for us. I would say the first thing that I heard from a lot of the industry when I started having discussions was that we talk too little of how much progress we've made. So though we are not quite Bangalore, we're actually significantly better off than we think we are. And on this floor of the assembly, I made the statement that in my estimation, we are seeing about 10,000 new jobs in the IT sector in Tamil Nadu every month. And that's without really doing much as a government. Right? So there's immense potential. The industry is in a great churn through a transformation that comes once every 15, 20 years with the advent of deep tech and AI. And certainly we see the vision and the example of Thiru Narayana Murthy of Infosys as a company, and then the companies like that followed, which shows the scale that we can achieve. I think for the foreseeable future, my own view is that India's growth accelerator will be the services industry. Though we have all these ambitions to be in manufacturing, in semiconductor manufacturing, in electronics assembly, the fact is we're so small that it'll take us a long time to build substantive scale. For example, Tamil Nadu went from being number 3 and number 1 to number 1 state in electronics manufactured good output on only one thing. Apple moved a bunch of its iPhone production from China to Foxconn in Tamil Nadu, and that just took us to number 1. One company, one trade. Big company, but still one company. So relative to the global scale of manufacturing generally, and in things like semiconductors, electronics, we are so far behind that I don't think it's easy to create an ecosystem. Therefore, for the foreseeable future, it must be about realizing the potential of the demographic dividend that we have of the fact that roughly 1 in 4 young people of employable age in the world for the next 10 to 15 years of employable age and education in the world will be of Indian origin. That's what the scale of India is today. About 1 in 6 of all people and about 1 in 4 of all employable young people today and for the next decade. So the services sector holds immense potential, and we must all work together to deliver jobs, growth, and better quality of life to our citizens. I want to say a word about the Rotary, which I say every time. I was a member of the Interact Club when I was in school, the Rotary Club when I was in college. I've said it before, governments can do macro things, sometimes well, sometimes great, sometimes not so well. But to reach the last mile, to find every niche, to find every need, we need organizations that are civic minded and are driven by the right intent and a societal mindset. And therefore, I think the Rotary does tremendous work, and I congratulate all of you for your efforts today and in the past and in the years to come. With that, I think I will pass on to the next session or next speaker, and apologies once again for being late. Thank you.
Questions to both of them. They are very much pleased to answer whatever questions you raise. So, please.
This question is for the Honorable Minister. I'd like to know if your department has any schemes or investment plans to promote research on artificial intelligence. As we all know, that is going to be the next big wave which will hit humanity, and it's going to happen very soon.
That's a very good question. I think, as I said, it's going to be transformative. And unfortunately, so far, at least if you look at the last 20, 25 years, the department has played mostly a facilitation role rather than the initiation of anything really new or big. We started to change that a couple of years ago when we came to office. We started something called the Innovation and Technology Hub of Tamil Nadu, where we have taken a building in Anna University. We are incubating startups. We are trying to provide some shared services. Other states are doing the same thing. We've gone around and seen other places. But when it comes to AI, I think the potential is something completely different. And is early thoughts. We still need to get it formulated properly and get the Chief Minister's approval. But I think the two things that are really promising for us, one is that after decades of trying to help people understand computers and work better with computers, we have finally got the processing power and the data capability to make computers adapt to human beings. And so the possibilities that you can now use technology for everyday tasks, for governance, for the interaction between the government and people are endless, particularly if you shift away from the text and input through keyboard and mouse concept to voice-based systems, which is where the future of AI really is anyway. So I think first, as a transformative channel or avenue for the government, the way it functions and the way it interacts with citizens. And multiple of the biggest companies in the world, the Microsofts, the Googles, we're talking to about doing some pilot projects of trying to figure out how we can get the bottom of the pyramid, those that we know through our studies are least able to access the government schemes and plans that we have for those people, how we can make voice-based interactive engines that will not just answer their queries but result in outcomes like enrollment into a scheme without having any human kind of interaction. But the second, and I think this I've been talking to a few of the AI startups or the AI established companies like Unifor that have now set up in IIT Madras about a 250-seat office which I opened recently. So there's an ecosystem building around here. We want to use those people to create a center of excellence and ideally provide two resources at that center of excellence. One is high computing capability. We were talking to Finland and a couple of other countries and some big funders to see if we can get some really fast computing and high processing capability that we can give out on few hours at a time to startups and to innovators and out of the box thinkers to help them test out their ideas or their models. But also, in most places, data is the enabler of these machine learning modules, and the biggest holder of data in most places is the government, because the government has data about everybody for everything, from when you're born to your certificates, to your education, to your community, to your income, all the way to your death. So with the caveat that we should remove the possibility of privacy breaches, if we can find a way to create relatively immunized data. Much of it is not yet online, unfortunately. A lot of government data is not online. But were we to bring all of that online, then that would be, I think, another tremendous source for both startups and innovators to be able to test out a lot of things and to glean a lot of insights. So, using the data and the scale that we have, we're almost 80 million people in Tamil Nadu, and that's a lot of information, and the government holds a lot of it. As well as creating a facility where you can get access to very high speed processing in blocks, I think can help us accelerate, and especially if we can do a lot of voice conversion of the data, then it's even better. So that's some preliminary thoughts based on the AI companies that we have been seeing come and set up in Chennai. Some of them scale, as I say, some of them more niche, but in the areas of medicine, of law, interaction at government levels or bank levels, these kinds of areas seem ripe for massive transformation through AI right now.
Whether it be the pharmaceutical, purchase or even consumption by people, I think the COVID vaccination was a big example and a triumph of how well digitization could happen to a country as massive as India. So for the state of Tamil Nadu at least, whether it be by self-disclosure by patients and people, so they can have sort of a blockchain or a vault where they can have access and also sharing of that knowledge with providers. Any thoughts on the government for that? Thank you.
Well, let me say something slightly negative about the vaccination data, right? It was a great system in many ways, but it had one deep flaw. When we came to office, the second wave hit like 6 times as virulent as the first wave. So we got a lot of inputs from many people. I was the minister for many different administrative portfolios, finance, personnel, administrative reforms, planning, development. So I was effectively doing a lot of the administration. And so we had a plan where we said, let's try and figure out where the most vulnerable people are. That is an overlay of who has, street by street or block by block or village by village, the most at-risk patients by age, either senior or young, those that have the least vaccination coverage, and those that basically are not likely to be covered by a PHC or a health center any other way. But when we went to get the data, we found that we were all putting the data into the system for vaccination, but there was no way to get it out. Right? Nobody had access to the data. They had built a good data capture, and I assume somewhere in the center of the system they could tell percentages and all that. But to make it usable, I needed to know percentage penetration of vaccination by street or by village or by block. Simply not available. So after a while, at least in Madras district, we started running parallel entry. We set up spreadsheets in every vaccination center, started taking our own data with voter ID so we could tell what was happening where. So, there's limitations. You do it quickly, you get some things right, some things need to be done better. But as far as the healthcare system is concerned, I made these comments when I was finance minister and I reiterated them as IT minister. And I said, there are 3 basic flaws in our system that are fixable by technology and by data connectivity. I mean, as good as our outcomes are, as proud as we are that we have the highest doctor, patient to doctor coverage ratio, that is one for every 250 people or something. The tertiary health centers are incredibly convoluted and very difficult to navigate. So if any of you has been to a GH recently, the one in Madurai, let me just give you an example, is like 27 acres and like 150 buildings. So where do you go for what care? Where's the outpatient? Where's the inpatient? Where's maternity? Where's eye? Where is emergency? There's no standardized design or layout, or there is no digital map that somebody can check ahead of time on the phone or the internet before they come. Or when they come, there is no map at the facility to say where should you go. So we have all this money spent and we have all these facilities, and it's almost impossible for the average person to penetrate what should be available. So I said either we should have standardized designs or websites or apps or some way, and we should clean up how these things are done going forward. That was the easiest one. The next is that the design of the health system is that you should start with your primary health center. And if you can't get the treatment there, it's something more complex, needs a scan, and it doesn't exist. In my constituency, I put scans in the primary health centers to reduce the crowding and improve other outcomes. But if you don't have that, then you go to secondary, then you go to tertiary. But there's no continuity. If a patient has to go from primary to secondary, tertiary, unless they carry their own records and their own medication slips and all that, the system has no way of identifying what has already been done with these people. So I said we must have, within the laws of privacy, we must have an integrated system throughout the government of Tamil Nadu, at least medical system, where the patient's history travels when they travel or when they shift location, so that it makes it easier, because most patients are not sophisticated enough to carry their records with them or to even understand what the records say. And the third thing is that though we spend almost 20,000 crores a year in public health, the reality is our data systems are so poor. We don't know how many CT scan machines are working at any time. We don't know how many X-rays are done on a given day. I don't know how many doctors have shown up for work today. I don't know how many procedures have been done. I had done a lot of work on this, and my friends in private equity in the healthcare space and in other health management systems had shown me examples of how the NHS was made efficient, how the German health system was made efficient, and how in large public health systems you have to actually generate data at a hospital level. Like per cost center, you must know how many doctors, how many surgeries, what was the success rate, what was the utilization of the CT scan, these kinds of things. So I had encouraged when I was finance minister that unless you get some of these things going, I'm going to find it very hard to allocate you more budget. Of course, I'm not in that job anymore, but recently the Chief Minister held an annual collectors conference where some of these issues came up, and I reiterated as the IT Minister that though we spend a lot of money and we get relatively good outcomes, we could get much, much better outcomes were we to do these basic things. And the other departments have committed that they're working towards what they call a HMIS, Health Management Information System or something like that, that will cover at least the second and third points I made. So hopefully we're on the right path, but I completely agree that right now it is such a broken system. We spend all this money, we don't even know what day the machine is commissioned or whether it's functional today. You should be able to tell by tapping a button in some control room how many CT scans are working, how many dialysis machines are working, and how many procedures were done. Without that, we don't know what's happening with the government's money. Yeah.
The final question is to our Honorable Minister, Thiru Thiagarajan. What is the impact Mr. Narayana Murthy has had over his lifetime and for Tamil Nadu, particularly its IT industry?
Well, I must say that I lived overseas for almost 30 years, so it's hard for me to be the fully informed arbiter of his impact. But I'll say it, even though a bit distant, I would say, as I said in my speech, as much for India and then, of course, for Tamil Nadu, but the notion that we could have companies of such scale that you didn't need to, come from some specialized insider deal. You didn't need to have any particular pedigree. You could basically, out of, um, you know, the grit, the vision, the kind of untiring effort, you could build an organization of global scale that could profoundly change the nature of the industry, both within India and globally. I think we must all agree that Mr. Narayana Murthy's greatest contribution will be that, to show that what an Indian company of scale, particularly in the technology sector, could do and what it could be, and that it could be replicated then by other companies that have gone on to do great things. If you look at the, by employment, largest tech companies of the world, I would say the top 5 or 6 Indian companies now probably are all in the top 10 in the world. So I think that vision, that determination, that attitude that nothing is impossible if you get the right kind of people together and put your mind to it and work hard enough, that is definitely a breaching of new terrain, and has inspired many companies, many individuals, many startups, many scale companies. And at least from the distance that I'm at, not only was I overseas, I spent the bulk of my career in investment banking and other fields. So I'm not the right guy to talk about it from a more personal or lived experience, but that's how I would see it from my seat.